For 100 years, the mission of Children's Health has been to make life better for children. Their beginnings in 1913 were humble, but their vision was even bigger. Today, the team takes great pride in being the 7th largest pediatric healthcare provider in the country and the only academically affiliated pediatric hospital in the area. We had the opportunity to go to Children's Health Center and interview 4 of Children's nurses in their beautiful facility. The complete mission statement says, "Our mission at Children's Health has always been to make life better for children. We have a long-standing commitment to our community that includes advocacy, education, and preventive care, as well as making sure that all children are insured." In the following pictures, you will see a timeline surrounding the lobby where we held our interviews. This timeline represents the history of Children's Health Center, beginning in 1913 up until present day. Charge nurse at Children's Medical. So tell me, do you guys have any child life specialists on staff? And how have they proven to be helpful?
Yeah, so each of our units has their own child life specialist. That way they can get to know the population for each kid. It's extremely helpful because they help with procedures, they help keep the kids calm, with anxiety. They're almost a little bit like counselors to some extent. I work with a very long-term population of kids who are here anywhere from 2 weeks to almost a year. So they've really become that liaison for us as well to make sure the kid feels safe in the hospital. If there's new procedures or new medications that the kids need, they're specifically trained in child development to help explain those procedures to the kids. So we really appreciate it.
To lower anxiety before any surgical operation. That's great. Now, in the pursuit of your career, can you tell me about any hardships that you face?
Yes, so I actually went to nursing school later on in life. So I worked full-time and went to school full-time. So it was a financial hardship because I didn't have any help to pay for it. I had to pay for it all myself, which was fine. So I just had to balance my home life, my work life, and my school life.
Well, thank you so much. We're here with Lisa Brown, Administrative Supervisor. So tell me, what specialties are you guys known for?
We have several different medical specialties. We have nephrology, trauma, cardiology, gastroenterology, hematology, oncology, and bone marrow transplant. For the most part, our hospital has become a very specialized hospital.
Okay, great. So what opportunities do medical students have for learning at Children's?
I think the best opportunities that medical students have are attending medical rounds with the whole medical team. So based on the specialty or the floor you're on, you'll go to medical rounds. It's usually about 2 hours and you discuss all of the patients on that floor. And then the attending physicians take the opportunity to pick 1 or 2 diagnoses that they are taking care of and go into depth about how to take care of the patient and what to look for and the labs they would need. So medical rounds would be the best opportunity, but obviously we have several.
Great, thank you so much.
You're welcome. Thank you.
We're here with Renee Richmond, also Administrative Supervisor. So tell me, Renee, how can you make sure that a child is getting the best care?
In my job as a nursing supervisor, we make sure that they get all the services that they need, the different departments. The nurses advocate for their care. We work with social work. We work with the chaplains and lots of different disciplines.
Okay, that's great. Now, you working in a hospital, what do you find to be the most stressful?
I think for me the most stressful is the parents, seeing them so distraught when their kids are sick, especially when we get traumas in the ER or they're diagnosed with cancer or some really bad illness. That's honestly the most stressful for me.
Must be. Anyways, thank you so much for your time.
Thank you.
we're here with Geneva Burnap, Senior Director of the Acute Care Center. So tell me, how does Children's Hospital deal with patients who are financially troubled?
It's one of the most important things to me about working at Children's because we are a not-for-profit institution. We take care of everyone. So while we have to eventually ask a person's payer status, that in no way stops us from treating them. We're also very lucky that the community supports us, and we provide about $50 million a year in charity care.
That is so great. Okay, so tell me, how do you fulfill Children's medical mission statement?
There are so many ways. Our mission is to make life better for children, and when you're a nurse at the bedside, I think it's really easy to feel that mission that you've done that every day because it's so much fun to be with our patients and their families. Over the years, as I've taken on more administrative responsibilities, it's a little bit more difficult to feel like you're involved in the mission day to day because you don't see the patients and families as often. You support the people that support our families. So to compensate, and it's a great time to talk about this because Saturday is our 27th parade in downtown Dallas, Dallas Children's Holiday Parade. And so I'm also co-director of the clowns, which right now is my most important job because we will have about 300 clowns on the street Saturday morning.
Oh, that's great. I'm sure many people are looking forward to that.
I hope so. I hope you'll all be there.
Sure will. Thank you so much for your time.
Thank you.